I'm Dr Quereshi. I'm a general neurologist here in Atlanta, serving the community for the last 15 years, really. And I'm here with Shayna Gross, who's a physical therapist, and I'm so excited to talk to you. How are you doing?
I'm doing great. How about you?
Thank you. I'm doing well.
Okay.
So I was so excited to sit down for this conversation because as I've gotten into my practice and in the field of neurology, from a practical standpoint, I find that the most common referral that I make for my patients, for the average patient coming through my door, is to physical therapy. And so I've been thinking about physical therapy for all these years of practice, and I think about that for my patients. Sometimes I even have to kind of teach them a little bit while I'm with them. Mm-hmm. And I was hoping to talk to you a little bit more about your approach to physical therapy, because I find it to be really not just evolved. I mean, I do think that you've got a really insightful approach, but also really practical. Mm-hmm. My patients who are coming in to see me, they might have issues that are uncommon or common. So for anything from like Parkinson's to multiple sclerosis and having had strokes, or common issues like spine issues, spinal arthritis, or also issues that might be related, like having issues in their hips, knees, ankles from arthritis. And the important common denominator there is that they're doing the same things that you and I do every day: sitting, standing, getting up from a supine position or laying down position, stooping forward. And so I was hoping that you could tell me more about your approach, like what makes you, or how do you see a patient in terms of what are everyday things that they can do to improve their motion and their health?
Absolutely. Well, thank you for having this conversation with me. And so the first part is just to think about what are some common things that we all do. Mm-hmm. And we all sit.
I'm sitting right now.
Yes.
And you're making me want to have good posture.
Great. Yep. There we go. It's a win. Most of us stand, most of us lie down. And so when I think about what people expect from a physical therapist, they expect a home exercise program, right? Everybody wants to have their custom home exercise program. And a very common question I get is how many reps, how many sets, how many times a day? And when I think about what we're already doing mm-hmm. all day, every day, mm-hmm. it's those same ideas: sitting, standing, lying down. Now, this doesn't preclude specific exercises for specific problems, but in general, if we all were to think a little bit more about the way we sit and the way we stand, it would set us up for an incredible foundation, because posture is like 1,000 reps of any exercise.
I find that maybe like around 15, maybe when I first started, that there was a concept of people engaging in their ergonomics, mm-hmm. like their ergonomic desk, their ergonomic chair, the idea that mattered. Is that kind of what you're talking about?
So in those concepts, you're talking about the piece of equipment doing the work for your body. Mm-hmm. Right? If you think about an ergonomic chair, it has this very curved back support that's going to allow you to lean into it. What I'm talking about is using your intrinsic muscular system, your deeper postural muscular system to do the work. Yeah. Right? And because of the lifestyle that we live so fast, so multitasked, so unfocused on the present moment in general, that leads to us taking advantage of the support of the equipment around us. When what really would be best for us foundationally is to figure out what our own support system looks like internally, because that's going to set us up foundationally, both from a strength and a conditioning perspective, to be able to age more gracefully, to age more functionally.
It reminds me of some of the cultural differences in different parts of the world. My mother is from a place called Kashmir, and I remember when I first went there when I was younger, how uncomfortable I was because there weren't any sofas and I'd be sitting on the floor. Right. And I was like surprised that I couldn't sit on the floor for very long, or my back hurt. And I was like a young person when I went there. And so I guess you're right. Like I tend to use like my furniture to support me. And what I hear you saying is like using my own body to support me from the inside out. One common thing I tell my patients who have back problems and they do physical therapy is to really stick to a lot of the exercises that are seemingly innocuous, because they're really building the smallest muscles around the spine. And that's what I kind of hear you saying, like talking about those intrinsic muscles right around the spine that actually hold you up, stretch you up, make you taller, stronger, and give you that like support from the inside out.
Yep, absolutely. Using that concept of tensegrity, using those small muscles that span a few segments of the spine to really create that length, and maybe we wouldn't shrink, right?
Right.
There's so much to be learned, and it's so basic, right? If we think about how are we sitting, how are we standing if we stand, how are we lying down if we lie down, and then what simple changes can we make? And there will be some content following this conversation that will give a little bit more information about that, but just noticing like, wow, what am I doing in this present moment?
No, I'm really excited about that, and thank you for sharing this content, because it's something that like I need to use like when I'm at my desk or cooking, you know, or just anything I'm doing. Like I like the idea of doing the kinds of conscious physical therapy that is built into my day, because then I'm actually making progress all the time. Well, thank you so much.
Thank you.
Yeah.